Today we're exploring rectal ulcers, a painful condition of the rectum that can affect digestion, comfort, and overall health. Solitary rectal ulcer syndrome (SRUS) is a chronic non-cancerous condition where sores form inside your rectum. Your rectum connects your colon to your anus. Stool passes through your rectum and your anus where you have a bowel movement. But the name solitary rectal ulcer syndrome is misleading. For example, if you have SRUS, you may have a single ulcer or you may have more than one. Also, the sores aren't always ulcers or even only in your rectum. They may be inflamed tissue or located in the part of your colon above your rectum. There's still a lot that researchers are learning about SRUS, including causes and the most effective treatments. Although the ulcers can be uncomfortable, they are usually not serious. The condition that causes a rectal ulcer can be serious, though. This is why you should see your provider to receive a diagnosis if you are experiencing symptoms of solitary rectal ulcer syndrome. Experts haven't identified a single cause, but several conditions that can injure the lining of your rectum may cause rectal ulcers to form. For example, solitary rectal ulcer syndrome often happens alongside rectal prolapse, a condition that causes your rectum to stretch and stick out of your anal opening. Rectal intussusception, a condition that causes part of your rectum to slip inside, telescope, and nearby part of your rectum. Severe or chronic constipation, a condition that makes it difficult to pass stools. Using fingers to remove a stool that's stuck can also damage tissue lining your rectum and potentially lead to rectal ulcers. Fecal incontinence, a condition that makes it difficult to control when you poop or how much stool you pass. One theory is that solitary rectal ulcer syndrome happens when the muscles that help you poop don't coordinate correctly to allow stools to pass. The lack of coordination can lead to ulcers. This is especially the case if you have a condition like rectal prolapse or intussusception that causes tissues that don't normally come into contact to touch or rub together. Symptoms of a rectal ulcer usually develop gradually and involve unpleasant bathroom visits. Signs and symptoms of rectal ulcer may include rectal bleeding. Blood is usually bright red. Mucus or blood in your stool. Straining to poop or having too few bowel movements. Feeling the frequent urge to poop but being unable to empty your bowels. And discomfort, especially when pooping. A feeling of fullness in your pelvis. Your healthcare provider will ask about your symptoms and bathroom habits that may have caused your symptoms, like frequently straining to poop. To check for rectal ulcers, providers use digital rectal exams and imaging tests. The most common test is an endoscopy. Your provider may insert a scope inside you to check for ulcers. Most scopes have cameras on the end that allow your provider to see inside your lower digestive tract. An endoscopy examines your anus. A flexible sigmoidoscopy examines your rectum and the lower part of your colon. A colonoscopy examines your entire colon. You may need additional tests so your provider can rule out conditions that cause symptoms similar to solitary rectal ulcer syndrome, like inflammatory bowel disease, IBD, and colon cancer. Tests include transrectal ultrasound. During a transrectal ultrasound, a provider inserts a small probe into your rectum. The probe uses sound waves to show images of the inside of your rectum so your provider can see ulcers and other growths. Difficography. This test can show if a condition like rectal prolapse or intussusception is likely causing your ulcer. During a difficography test, X-rays or an MRI, machine will record how your muscles work in real time to help you poop. Anorectal manometry. Anorectal manometry shows how your pelvis floor muscles are coordinating to help you poop. During the test, a provider inserts a flexible tube with sensors inside your rectum. It records how your muscles respond to pressure. Biopsy. During the endoscopy, your provider may take a biopsy of the tissue surrounding the ulcer and send it to a lab. Lab tests can show if the cells are benign or cancerous. Treatment for solitary rectal ulcer syndrome depends on the severity of your symptoms and what's causing them. Many people with mild to moderate symptoms find relief by changing their eating habits and bowel habits to relieve constipation. Often not, straining to poop gives your ulcer time to heal. Your provider may recommend that you drink plenty of water, eat a fiber-rich diet, avoid straining during bowel movements, try a laxative, try medications that treat ulcers. Thank you for being with us until the end of this video. In this video, we tried to teach you about rectal ulcers and ways of preventing it and also symptoms of it. If you are interested to know more about medical world, don't forget to subscribe our YouTube channel too.